Last talk of our session is given by Dr. Jolie Zhu Wen Wang from the School of Cancer and Pharmaceutical Sciences, King's College in London. She will talk about imaging carbon nanotubes journey from basic understanding of the carrier biodistribution to Alzheimer's disease monitoring.
Good morning, everyone, and thanks for Chairman's introduction. And so our group already have, in the past few years, we have designed and then developed various types of chemically functionalized carbon nanotubes as nano carriers to deliver drugs and imaging probes for therapeutic applications. So in particularly today, I would like to focus on the imaging side, which we use carbon nanotubes as an image contrast agent, and then also focus on the brain delivery. So, for example, in this study, we developed a hybrid CNT. So, CNT hybrid CNT and iron oxide, which is can be labeled with technetium. For dual nuclear and MR imaging. So as you see, and the linkage is by the biphosphonate to link with technetium. So as you can see in the pictures, this hybrid can be imaged by MR. This is the liver of the mice, and then also can permit SPECT-CT imaging. And in another study, our group pioneered the idea of carbon nanocapsules. We encapsulate the radio-emitting radionucleotide. So this sugar functionalized carbon nanotubes is filled with iodine-125. And at that time, these carbon nanocapsules can target the thyroid for diagnosis. At that time, we were not able to achieve high loading payload of iodine. So this compound was able to do imaging, but not for therapeutic purpose. And then in a further study, we changed our concept. We filled the carbon nanocapsules with samarium-152, the non-radiated samarium. And by neutron activation, we can produce the radioactive samarium in filled carbon nanotubes, and then also further functionalized with antibody for tumor targeting. And in this study, so we can see these carbon capsules. They are both diagnosis, can do SPECT imaging, and then also therapeutic. In this lung metastasis model, we can see it's successfully reduced the tumor growth and then shown therapeutic effect. So go back to the brain study. So in our in the past, we found that one of the carbon nanotubes conjugate they have the intrinsic brain targeting properties. So, able to check the deposition of the carbon nanotubes in the brain, we have developed several techniques to image the carbon nanotubes in the brain. So, by using the intrinsic properties, we can image the carbon nanotubes by Raman, by multiphoton lifetime imaging, fluorescence lifetime imaging, and also because carbon nanotube is electron dense, so we can image them in the brain ultrastructurally. And also the carbon nanotubes we can label with a nuclear probe, and we can do live imaging and also look at the spatial resolution by autoradiography. So just show you some examples of the imaging. So this is SPECT-CT of the brain. So you can see that the compounds is accumulate in the brain and then decrease over time. And by the intrinsic optical properties, we use multiphoton microscopy. So we excite the compound at 950 950 nanometer, and nanotubes emitted light in a wide range of wavelengths. And when we have the merged imaging, so the rate, we inject the dye to label the blood vessels. So you can see this is blood vessels, and the carbon nanotubes is deposited in the brain parenchyma. So for this study, so we would like to develop this brain targeting carbon nanotubes for Alzheimer's disease. So it's Alzheimer's disease, as you all know, it's a chronic brain disorders, and the clinical size accumulation of the tau aggregates and also the amyloid beta. And the detection of amyloid beta is be used clinically as a diagnosis and disease progression. So a group, our collaborator, Professor Avato at Strasbourg, at CNRS in Orleans. So their group already. I go back. So the so clinically to detect the amyloid beta aggregates, there's a compound called Pittsburgh compound B, and also other small organic compounds. So they have a high affinity of these amyloid beta aggregates. And clinically, they are clinicians using PET imaging to detect the presence of the amyloid beta. The disadvantage of this small organic group, including the Pittsburgh compound B, is the short life. So they do PET CT, and the lifetime of the isotopes for PET is very short. So Professor Avato, so their group, they try to synthesize derivatives of the Pittsburgh compound B, and which they would like to replace. They conjugate with the DOCA chelator, which can stably complex with trivalent metal ions, for example, gadolinium. And with gadolinium, then this compound can be imaged by MR, which brings better resolution compared to PET. And also, because it's trivalent, so if we put with indium, then this compound can be imaged by SPECT CT. And the group in CNRS, they test them. This compound has good amyloid beta B binding in vitro. However, the BBB penetration properties dramatically dropped. And to overcome this problem, so we collaborate, and we hope we can use this our brain targeting carbon nanotubes to deliver the Pittsburgh compound B derivatives to target the amyloid beta for Alzheimer's disease. So this work I'm going to present, we published in this year, and then as I described, we want to see if we can deliver the compound to the brain. And the work is in collaboration with Avato, that what I just mentioned, and then Professor El Jama and us at King's College London. So the study is so in their paper, so they previously developed these derivatives. We call it L2 here, and it has good in binding in vitro. And however, in vivo, we want to have better brain targeting. So they synthesize another directives. We call it L3 here, with an improved log P value, so increase the hydrophobicity. So there are two ligands we are going to test here, and then we mix with our brain targeting carbon nanotubes, and then we want to see how they behave in vivo. So so we label the compound, and then here we displace with gadolinium. We only use the ligand because we are going to label the ligand with indium. So we do the radio labeling, and then you can see this is the free ligands. the thin layer chromatography. So they migrate to the solvent front. And here is the 4-compound conjugate. And then it shows that high radio labeling efficiency. And the L3 is slightly lower, but still a good radio labeling efficiency. And here I show the spec CT image of the whole body of the animals. So you can look at this. This is the L2 on the top panel and the L3 conjugate on the bottom panel. And the L2, L3, they displayed faster renal discretion and urinated out. And there's also some accumulation in the bladder indicating the biliary excretion. And the carbon nanotubes themselves, they have similar biodistribution. However, if you look at the top and bottom panel with L2 and L3, which are structurally similar, however, their biodistribution is quite different. So the L2 conjugate, they have a higher lung accumulation compared to the L3, mainly accumulate in the liver and the spleen. So they are very different in terms of their biodistribution. And if we focus on the brain, so the top panel are the L2 and the L3. This is the brain in different orientations, sagittal, coronal, and then transverse. So I'm not sure if you can see clearly with this light, but you can see that the L2 compounds have more brain accumulation compared to the this is the oxidized carbon nanotube. This is amidated, and amidated ones has more brain accumulation compared to the non-amidated. And same phenomenon was observed in the case of the L3. So this is pharmacokinetic studies. So the ligand itself has higher concentration in the blood. However, the conjugates, they stay very short time in the blood and is distributed to the body very quickly after injection. And if we look at the brain, to eliminate the presence of the compound in the blood, so we performed capillary depletion to separate the brain parenchyma and the capillary. And you see this quantitative analysis that the L2 conjugate, the amidated one, has a lot higher brain accumulation in either the parenchyma portion or capillary portion compared to the L3 conjugate. So to conclude that we successfully deliver this Pittsburgh compound derivative, which was not able to penetrate the BBB, but now they can go to the brain. And the future work is we are testing the binding affinity of this hybrid conjugate in vivo, and as well we want to improve the brain targeting. We have another carbon nanotubes compound which has the brain targeting ligand NGO-PEP. So we hope that with using this NGO-PEP conjugated carbon nanotubes can improve further the brain targeting. And then also we would like to test the system in the Alzheimer disease model in future. Thank you.
Thank you very much for this interesting talk. Yeah, there's some question.
So at first, congratulations for your L3 compound. Actually, so let me reinterpret all of your presented images. I'm sorry to that. The first and second, third already published images in Advanced Functional Materials 2010 and Nature Materials later and later. All those carbon nanotubes were taken up by the lungs, so you do not have modified the surface, and those once injected immediately agglomerated and then blocked capillary of the lungs. So it did not make through the systemic circulation after intravenous one. So your L2 compound showed the same, so it is useless. And finally, you could just make an L3, which passed through the lungs and then systemic localization. So My question is, have you they quantified the brain uptake percent ID per gram or per organ? So I don't see clear image. The previous one would have been intracarotid injection, right?
No, they all systemic injection by
Systemic
tail
injection.
vein.
So,
Yes.
so image presentation, just getting rid of the rest of the body, is going to give us a false impression that brain would have taken up those compounds. So you need to just show and finally, your last slide showed us that the brain is almost void. So, but you are saying that the L3 is brain uptake is a little bit higher, but L3 lung uptake was not there. So it should be higher than the L2. They're showing a much lung uptake. So despite your previous publications, which at that time we did not know about the corona, at that time there had been a limited knowledge about the surface modification or pegylation, so we understand. But your introduction was really confusing and not real.
Okay, so thank you for the comments. And because of the time limit, so I didn't show the entire biodistribution profile. So actually, because they are radio labeled, so we do quantitative analysis for the organ uptake and not just the brain. So the data I show is because this talk is focused on the brain targeting, so I only show the data for the brain. But in the paper, I put in the introduction. So and we have the detailed pharmacokinetic analysis of the compound in the organ over time. So I think maybe that's why a bit misunderstanding that if majority goes to actually, yeah, you see in the SPECT-CT imaging, so a lot of compounds accumulate in lung and then liver, and then we know that for carbon nanotubes, that is something typical biodistribution for carbon nanotubes. However, for brain disease, you don't need a large amount to reach brain, and if your drug or are potent, then you only need a very small percentage of injection dose, and that could be therapeutic enough to kill a tumor, for example, or other CNS disease. Yeah.
Sorry, just I probably missed it. What's the physical dimensions of your nanotubes, aspect ratio? So how long are they in nanometers, and how thick they are?
So this batch of carbon tubes, they are about 200 to 300 long, in nanometer long. And then the diameter, these are multi-word carbon nanotubes, so they are 30 to 40 in diameter multi-word.
Yeah.
That's their aspect ratio, yes.
Okay, well, in this case, unfortunately, I have to agree with Dr. Lee that pursuing the in vivo applications of those carbon nanotubes would be extremely complicated, if not impossible at all, because first, they're all going to be frustrated phagocytosis because of the high aspect ratio nanotubes. Second, they'll never pass the urine kidney barrier. So they'll be, I don't see it approved by any medicines regulator or even diagnostic, whatever. So it just, it's a dead end. I don't know. You have to invent something. You have to chop them, probably. I don't know.
Yeah. So carbon nanotubes is difficult compared to other liposome, for example, or polymeric particles. So I would say that it's difficult, more difficult compared to them to go into clinical trial. However, it's a tool because it has very different inorganic properties. So it's enabled us to test some systems and then to prove our concept if this strategy works and etc. Yeah. So.
Thanks.
So is it the last question now here?
Yeah, I'm not an imaging guy. I'm a neuropathologist, but and I'm a bit sorry that you are being given so much pushback. But I mean, what you need really to show is PIP compound alone. What is the penetration of PIP compound alone? What is the binding of PIP compound alone in the brain of an Alzheimer's model? what is the penetration of PIP compound conjugated to your caged thing, and what is the penetration of the PIP compound conjugated with your caged things together with the nanotubes. These are the three things that you need to show next to each other, and then you can actually draw any conclusion whether your modifications do something good or not. It's a very simple simple experiment, but this is crucial.
Yeah, so we did that. So the last image, if you last slide, if you remember, there is we do the ligands itself, so L2 and the L3, and then we show the best conjugate, which is the amidated, and then the ligand itself, it doesn't go to penetrate the brain, and so.
But PIP compound does penetrate the brain.
Oh, so this is not a PIP. Yeah, so this is because we want to do MR imaging. That's why we want to replace we don't want to do the PET. So we want to introduce MR imaging to image these Pittsburgh derivatives.
Okay, now final question.
So it's more of a comment actually in answering Professor Lee. So the Nature Material paper was the first proof of concept that you can fill and close the nanotubes with a radio emitter. So the purpose was actually not focus much on the targeting as to the physical approach of filling, but the amount filled was not enough to cause radiotherapy, and the following studies was showing that you can actually achieve amount with specific radioactivity of 4 gigabecquerel per milligram of nanotubes, sufficient to be used for therapeutic applications. So maybe clarifying the context of the study. And in terms of the quantity per gram, I think Julie has showed it in the last slide, where you have clear difference between, although the SPECT images, as obviously you can see the liver uptake is very high, you wouldn't see it on the SPECT, but with the quantitative data, it's clear that it's at least 10 times higher. Now, considering how this goes forward to clinical application, obviously we admit there are limitations. So this, I don't think, affects the validity of the conclusion from this data. That's what I want to say.
So, thank you very much for this final statement. I love these discussions. You know, this is why Congress takes place. So we have controversial opinions and we have to exchange our knowledge here. And I would like to thank all the speakers of this session and the audience for your attendance. Thank you very much.